Some promising news over the weekend in the fight against COVID-19. New cases statewide on Sunday saw the lowest daily increase in 2 weeks, but we have still got a long way to go. Dr. Jason Wilson from Tampa General Hospital joins us now. Dr. Wilson, good morning.
Hi, thanks for having me.
Yeah, sure. Thanks for being here. Okay, so what are you seeing right now in the numbers locally that's encouraging or particularly concerning for you?
Yeah, let's start with the positives first. I think the positives are that over the last 2 weeks, we've seen declining rolling day averages. If you go back to the early part of July, that first week of July, we were at around 50 cases per 100,000, so almost 650 new cases per day. Down now to about 500 new cases per day. Hospital census has also stayed pretty stable. Again, remember going back into mid-June, we probably had 70 people in our hospital at any given time with COVID. Now pretty consistently more like 50 at any given time with COVID. And then the other thing I think is very encouraging as well is when we keep that capacity under control, then we can keep our case fatality rate, the number of people who die from COVID, at very low numbers as well. So that's also an encouraging piece of news. Numbers still high, though. Numbers are still 15 to 20 times higher than we saw in May before we reopened.
Yeah, I mean, we were talking the numbers, about the number of cases since Friday, and I think it's easy for people to watch those local numbers tally. It looks higher and higher. You have to put in perspective, though, I think also, because these numbers are delayed as they're being reported.
That's right. We're still magnitudes over where we were before. And the really concerning thing about where we are right now is that even though we're coming down, we're one super spreader event away from jumping right back up to where we were. That's why these public health measures like wearing a mask and distancing and really avoiding those indoor places still remain critically important. Those measures really only work as we get the numbers down. They become more effective. Numbers as high as they are right now, it's really hard to have any kind of mitigation strategy.
Yeah, I'm sure. Wow, one super spreader event away from danger. Again, that's an interesting way to put it. Okay, so you're seeing these patients that are coming in. Are you seeing any lingering side effects in some of the patients who no longer test positive?
You know, it's interesting, as this virus unfolds, we learn more and more about it. And I think what we've learned more and more is that there are some downstream things that affect your body from this virus that we're just now starting to see. So we saw a case series come out last week from Boston of 75% of people affected by COVID had some kind of heart damage.
Yeah.
We saw a study come out from American Stroke this weekend that showed about 2.5% of people with COVID are having strokes. And we're learning also that just patients we diagnosed in March, even the young healthy patients who diagnosed in March, we still see them having struggles with shortness of breath, chest discomfort, and feeling tired.
Wow. During March and April, we reported a lot that people were putting off their essential medical care. They were avoiding the hospitals. They were afraid of contracting COVID. Are you still seeing that now, or are people starting to kind of heed the advice when, to get care when they need it?
Yeah, people did a really good job of doing safer at home. Unfortunately, I think they also didn't recognize that they could come in for serious emergency events. I think we're in a place right now where that message has gotten out there that really, I think every hospital in this area is a safe space. I've said this before, but I always feel safer at my hospital than I do anywhere else because everybody's at least following all the public health strategies there. And so I think we're starting to see now people recognize they can come in for their medical conditions, which has also been an interesting part of this virus as we see people who've had COVID or are recovering from COVID who also have other medical problems that they need treatment for as well.
Yeah. Okay. All right. Well, we appreciate what you're doing. We got to leave it there. Dr. Jason Wilson, good to see you.
Good to see you too. Happy to come by anytime.
Yeah. Stay safe.